Let a Sinai-Grace physician help you keep your New Year's resolution and save the date for a special MLK celebration. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. 2012 is right around the corner. What's your New Year's resolution? Psychologists find that 50% of Americans commit to something, and the top challenges are losing weight and quitting smoking. There's no better time to wipe the slate clean than the first of the year. But those same psychologists find that the first 2 weeks of a resolution go great. By February, people are fudging a little, and by December, most have completely fallen off the wagon. To keep you on track, make an appointment with your Sinai-Grace Hospital primary care physician at 1-888-DMC-2500. They've got lots of tools and support to help you become healthier in the new year. Mark your calendar for a special celebration on January 16th. Sinai-Grace Hospital is celebrating the life and time of Dr. Martin Luther King Jr. Please join us from 11 to noon in the ground floor auditorium. And now here's Tina Taylor with some tips to keep you healthy. Tina?
More than half of all Americans aged 65 and older have cataracts, a painless, cloudy area in the lens of the eye that can cause vision problems. So what causes this condition and what can we do to keep our vision sharp? I sat down with Dr. Monica Alexander to find out.
Cataracts are the natural lens in the eye. Usually with aging, the lens hardens and becomes more opaque and cloudy. Some of the symptoms of cataracts include blurred vision. That's the big major problem that people have. They also have difficulty detecting color. Oftentimes people have difficulty with driving at night, especially with glare with bright oncoming headlights. Also, people have difficulty with reading. Most often it's those that are elderly, those that are starting at around 65 or older. That's the most common group of people. People who have had trauma to their eyes, they're all at greater risk for developing cataracts. Most oftentimes people can just be treated with a new pair of glasses. We'll just test your prescription in the office and give you a new prescription for glasses. If it gets to the point where the glasses aren't helpful, then it's time to consider cataract surgery. Cataract surgery is an elective procedure. So cataract surgery is only performed when the patient feels as though some of their usual activities are being compromised. Cataract surgery is an outpatient procedure, which is usually done under local anesthesia. And it's a pretty quick procedure. It takes about 15, 20 minutes to do. What we do is we make a very small incision in the eye. It's about 3 millimeters or less. We use an instrument that'll take the cataract out. Then we put an artificial lens implant in its place. They're usually made of acrylic or silicone, and they're clear and they're placed in the eye and they stay there for the rest of the life. Patients that have astigmatism, we give them toric lenses, as you would get like a toric contact lens. We also have multifocal lenses. So some patients that don't want to use bifocals after cataract surgery, we have lenses to place inside the eye in which they would not require glasses to read at a distance or up close.
Risks are inherent to any surgery. However, today's standard cataract removal process is efficient and refined, and for the vast majority of patients, the process results in clear vision immediately or within a few short weeks.
Oftentimes people can resume their normal activities within the next day. Sometimes it takes a little time. Everyone has a different recovery period. The best way to prevent the onset of cataracts or delay it is to use ultraviolet protection with sunglasses.
Eye exams can help detect cataracts and other eye problems at their earliest stages, so be sure to ask your doctor how often you should have an eye exam. For a Sinai-Grace ophthalmology specialist, call 313-966-4800. I'm Tina Taylor for Sinai-Grace Today.
I am Dr. Franco Attanasio, and this is your Medical Minute. It's that time of year again, cold and flu season. So how can you tell if you had a common cold or if you have the flu. Although both illnesses are caused by a virus, there are some differences. A cold usually starts with a sore throat, followed by a runny nose, congestion, and coughing. When you have a cold, it is unlikely that you will have a fever, and the average cold lasts between a few days and a week. The flu comes on fast with severe symptoms and is often accompanied by a fever of over 100 degrees, as well as body aches and fatigue. With the flu, you feel run down for a week or more. So how can you avoid getting sick in the first place? As they say, an ounce of prevention is the best medicine. Wash your hands frequently with warm soapy water for at least 20 seconds. Remember, these viruses are passed through mucous membranes in the eyes, nose, and mouth, so avoid touching your face. Diet and exercise are an important part of staying healthy year-round, so remember to eat those veggies. And of course, getting your annual flu vaccine is the best way to avoid getting the flu in the first place. Your primary care physician is the cold and flu expert. If you don't have a primary care physician, or if you'd like to make an appointment with one, please call 313-966-4800. We'd love to hear from you. I am Dr. Franco Attanasio, and that's your Medical Minute.
Is it true that you can't get pregnant while breastfeeding?
The question is it true that you can't get pregnant while breastfeeding? As an OBGYN at Sinai-Grace Hospital, many people believe that you cannot get pregnant while breastfeeding. That is not entirely true. While you are breastfeeding, your ovulation is prolonged or it's delayed. So many people believe that you cannot get pregnant while breastfeeding. However, there has been many cases with women getting pregnant while breastfeeding. So I would recommend, as an OBGYN, to have a secondary method of contraception. So the question is, you can get pregnant while breastfeeding. The answer is no. This myth is busted.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.